A hearty good afternoon and welcome to a session on myths associated with breastfeeding. We are glad to have Dr. Susanta K Badatya among us today to help us understand the topic. Breastfeeding is one of the most important functions of a new mother, and it's a primary process to help deliver nutrition to a newborn child. And it is one of the most important activities in the life of a child and mother. So the doctor will help us understand breastfeeding better by dispelling some myths and explaining some more facts about it. So, doctor, you have the stage.
Thank you for the opportunity. I am Dr. Susanta K Badatya. I will be discussing some myths and the facts about the breastfeeding. So, as we know, we are celebrating the breastfeeding week every year for August the first week. So, the idea is to promote and to re-emphasize the best food available to the baby, that is the nature has arranged the breast milk. So we should be promoting and practicing the breastfeeding as much as possible. It's not about the whatever possible, whatever the best we can arrange for the baby is the breast milk. So as we know, every mother and child in this nature has given the opportunity for the mother to nourish the baby through breast milk. So human babies are not different, but as compared to other species, human babies need some more assistance when this phase come to the breastfeeding phase. So as our social structure has evolved and medical science has evolved, gradually as the incidence of cesarean sections and the other health comorbidities has come up, the somehow the mothers are being pushed for the alternative method of nourishment, and they are lost in this process. The babies has lost the benefits of the breastfeeding. So two factors play a role in the delayed breastfeeding or decrease the breastfeeding rate in the early infancy. First, the social structure, the presence of nannies or the help, daily helpers around the mother. They put some prejudiced thoughts in the mother's mind, so they create doubt in the mother's mind to prevent the uh, real utilization of the breast milk. So they put very misinformations in the mother's mind. So they create the doubt in the ability of the mother. So today, before going to the myths, everyone talks of the fact. The fact is that the breast milk, the best milk. There's no point further to emphasize more the facts about the nutrition. It is the simply the best milk, best food available for the baby in terms of nutrition and in terms of the first immune booster for the baby. So this is also first vaccination you can take. You say so. This is also nutrition. Also is the immune booster for the baby. So fact is that breast milk the best milk, no doubt about it. But the myths related to the breastfeeding initiation and how to win the breastfeeding, is it early winning or late winning, how is the it is going to affect the baby's growth and development, and the use of supplemented feedings while you can are going to breastfeed, and what are food habits during breastfeeding. These are all these little myths are little, prevalent in our society. So we'll be talking one by one. First, there is a common misconception that as babies are another species in this world, babies are naturally know how to breastfeed. That's true, but this is- apart from the natural instincts the baby has inherited from by birth, they do not guarantee the smooth breastfeeding process. So for mother also and for baby also, they have to learn the basic things before the breastfeeding is established. So like the how to position the baby, how to latch it, and how to recognize the early feeding signs. These all things help in successful breastfeeding. So uh, every baby after post delivery, then mother should be patient enough, and they should try to learn how to breastfeed each time. So by practice only, every time they get opportunity of around 8 to 10 times at least. So with time and with practice, they will excel. Both babies and mother, they get used to the breastfeeding process. Another thing, second myth we encounter in our routine practice is that uh, post delivery, even with normal delivery, normal vaginal delivery, or after this operative delivery, they start thinking that milk will start to flow once mother starts eating something. So yes, it is necessary that mother is nourished adequately, so that the building blocks which body will utilize for production of milk, they will be available with mother. Otherwise, mother's the milk quality will be suffering, and mother's body will be exhausted. So it is necessary to nourish the mother according to the phase of treatment and the postpartum. But the milk production is a hormonal process. So once the baby is delivered, the lactogenesis starts. So irrespective of the nutrition the mother is getting, if the lactogenesis hormones are released in the mother's body, then the milk production process has already begun. So two things are important. First, the mother should be relaxed enough so that there is no inhibitory factors going on in the mother's body, so that there is the milk hormone, the prolactin, the levels are enough maintained, and the uh, demand process is also there, so that baby latches the baby body, so that the milk injection and milk production both are facilitated. So once this process is not there, like baby is not coming to mother side, and mother is always getting anxious, and baby is not getting skin to skin care, or not latching properly, so milk production delays. So even if baby is in NICU, or baby is not with the mother, then mother can visit the NICU, or maybe may just mother just have a visual contact with the baby, so that the affection comes into the play. So the joy hormone, the prolactin starts beginning of the lactogenesis starts. So it's important that nourishment starts, but it's not necessary at once to start the lactogenesis. Second myth we always encounter, that breast pump usage is not good for the milk production or lactogenesis, or for the breastfeeding process. So you need to understand that baby is also, you can say in a broad sense, that baby is also a natural breast pump. It extracts the milk itself with its better sucking power. But in case baby is not with you, or the already there is engorged breast, so that baby is not able to latch or suckle, so then you have to assist the mothers to empty out the breast. So the breast pump, by using breast pump or manually, you can empty out, so that once this emptied, then the milk flow is also improved, baby can suckle in better way, and the breast milk, whatever is present inside the breast, they can be also utilized. So breast milk usage is not going to harm the breast milk production. But each time you are just taking out the milk by breast pump and not letting the baby to attach and suckle, then over the weeks or whatever days, it may happen that the breast milk production gets decreased. So that as the body needs the skin to skin contact and the latching of the baby to have a sustained prolactin level. So that is the thing we should take care of. In first few months, the persons in around the mother always put the notion that the mother's diet has very much influence in the baby's growth and behavior, etc. But you need to understand that apart from growth and immunity, there is no harmful effect of mother's diet on baby's milk. So there is no nothing in mother's diet should be tailored for the baby's breastfeeding practices. So mothers can take anything that is healthy for the mother's health itself. So you should avoid the highly caffeinated beverages. That's true. You should avoid the seafoods, those highly allergenic foods, or and you should avoid these alcoholic beverages. These things can pass on to the baby through milk and may cause symptoms to the baby. Otherwise, these common things like yellow things in the mother's diet or green things in the mother's diet, they are not going to influence baby's behavior further. Some medications, those are very, although rare medications, they can be avoided, should be avoided during breastfeeding. Those you will be guided by your uh, guiding. So it is also a known fact that whatever you eat, those flavors pass on to the baby through breast milk, so that whenever baby starts weaning phase, they are shown to like those kind of flavors or those kind of food materials more. So we always encourage during antenatal period also, mother should eat as much as a healthy and variety of food, so that mother is babies are gets the flavor in utero also. So that is thing we always ever. So everything is not related to food intake. Baby has become diarrhea, baby is having any fever, so there is not related to any breast milk itself. So the diet has very little or no influence on baby's behavior. Some diet as I have outlined, those can influence the baby's behavior. Third, with in context of the diet, we encountered that when mother is ill or down with fever, or there is some viral infection or bacterial infection, they should not feed the baby. So it is the fact that breast, there is no documented evidence of transmission of routine infections or common infections from mother to baby via breast milk. Apart from some chronic infections, those can be individualized, but common infections, so they can't be transmitted through breast milk. So you should continue the breast milk usage during fever also. So direct breastfeeding is always advised, so that the whatever immunoglobulin mother's body is producing, they are also transmitted to the baby, so that has help in passive immunization of the baby. So it is advisable that the baby may get infected from mother through contact or through the closeness, so that you should take care that mother is taking all sanitizing practices. They are wearing masks if there is any respiratory illness. So these are the contact precautions should help the baby to prevent the infection. Otherwise, there is no restriction for breast milk feeding. Uh, Further, they always have a practice of using breast milk. Apart from breast milk, they always use formula once a day or twice a day, just to ensure that whenever baby is going to wean from the breast milk, they have a habit of taking breast formula. So this is a very wrong practice, because whenever we will try, baby will take the breast milk and formal milk, but just because we have a social obligation to join duties or after certain months, we should not use formula, because we never know what problems we can land up with the formula. So it's very important to avoid this type kind of practices, and the you can always take help of specialist to outline the management of when you are going to wean off or when you want to join the duties. So it is very convenient to start formula, but the essence of the breast milk usage is gone once formula is started, as baby gets used to the formula itself, and they slightly go away from the breast milk process. And it's a very common notion around mothers that my baby is not getting enough milk. They are giving only once or twice formula milk, but they are also having a strong belief that they are not having enough milk. If baby are not getting enough milk, they will demand every 2 to 3 hourly. But that's not the case. They only give once or twice, but they always have a thought that my baby is not getting milk. So you need to understand that every mother, it's known fact that less than 1% only out of 100 babies on combination, only one mother can have a less production due to various medical reasons, or otherwise from 9-10% cases the breast milk production is right amount of milk is there for every baby. But how quickly they get emptied, or how quickly baby gets aroused, so these are the things they decide how frequently baby can demand the breast milk, and whatever the demand is, you can always feed the baby. So that you should practice always that demand feeding is the best feeding, and you should always monitor the weight gain pattern. If baby is gaining weight adequately, then there is no reason that we should go for formula milk. And there is always we all try to convince mothers on the basis of facts, and we use always the growth chart to show them that your baby is always growing in centile, or at least maintaining his centiles. So they should not be worried that they are not producing enough milk. Enough milk is there, so that's why baby is gaining weight. So it's our job to convince them, but they need time to understand with the use of visual aids. Third, in the same segment of using formula, we can judge that it's not hard to win a baby if baby is almost feeding for 2 years. So most parents say that if we are using breastfeeding for more than 1 year, it will be hard. So they try to wean early, that is 6 months or 7 months or by 12 months, they start weaning, so that the weaning process completes by next 2 3 months and they are done. So it is a very wrong practice. The WHO has already advised breastfeeding to continue till 2 years. It is not only that nutritionally they are not so much dependent on milk, but whatever nutrition is through the breast milk, it's the best thing baby can take in. So also the immunological advantage remains still 2 years. So it is never advisable to wean from breast milk before 2 years, but the complementary feeding should be there. It's not that out of 100%, 80% time babies only on breast milk. That is also wrong. So you should start weaning from breast milk, but it should continue breastfeeding till 2 years. There is no stoppage of breast milk before 2 years. So parents ask that how can I stop breast milk? So I always advise that you should continue whatever amount is there is there, and whatever opportunity you get after 1 year, you should continue breastfeeding. That's the emotional angle, and that's also a nutritional and immunological angle. Uh, if mothers are very much preoccupied with the notion that giving formula will fetches more sleep hours so that they can rest. So initially, I understand the initial first few weeks there becomes a sleepless condition for the mothers also. So breastfeeding is not only for mother and baby; it's also in the responsibility of every family members to create an environment so that mothers don't feel lonely in the breastfeeding process. So that means mothers also need proper rest so that they can continue the breastfeeding. So even if mother wants to breast feed and take rest, so they can once or twice they can express out and keep their milk handy. Meanwhile, mothers can take a rest for few weeks initially, because we can't replace mother's milk with a formula. So it's very easily digestible. So babies will get up early. So like 1.5 or 2 hours, baby may get early even if baby is adequately fed. So that is not reason to start the formula milk. Formula is a very hard to digest, so they may take longer time to wake up again. But the association of formulas with other disorders like allergies, that is the lack of nutrients leading to the multiple respiratory illnesses, diarrheal illnesses, and the lack of metabolic disease lowering property of the breast milk. So these are things make the formula a bad choice when the mother's milk can be utilized well. Um, Last we discussed when we wean the baby from breast milk. Parents often think that babies do not need breast milk when they start having food. So even if baby gets majority of nutrition from solid foods, as we discussed, uh, the breast milk always supplies the rest of the nutrients and the immunological parameters. So babies definitely need breast milk in addition to the solid foods till 2 years. Uh, in some subsection of the babies where they are NICU graduates or there are the preterm babies having low birth weight, they may need extra supplementations in addition to breastfeeding. So in addition to breast milk, case to case basis, they cannot be generalized. So that in all discussions we always take the term babies and the healthy babies, those are delivered after 37 weeks to 40 weeks, and they are always discussed. But in those subsequent babies where those who are discharged from NICU and they have come some comorbidity conditions associated, or there are low birth weight, so depending upon the weight gain pattern and their clinical condition, parents are often advised to use some supplement formulas and to even to fortify the breast milk itself. So they cannot be generalized, but even if they have been advised, so parents should understand that they are according to the need of the baby. So these are things we always discuss in their OPD practice, that some myths are as bound to remain in the minds and the practices, social practices, but it's our responsibility to explain everything scientifically. So I think we have discussed every aspect of the myths. If there is any questions, we can take in this session. Is there any questions you can guide?